Ladies and gentlemen, hello and welcome to this daily press conference on the situation of COVID-19 in Quebec. Today we have with us the Premier of Quebec, François Legault, who is back after one day off that was well-deserved. I hope you were able to rest a little. We also have the Minister of Economy and Innovation, Mr. Pierre Fitzgibbon, and Public Health Strategic Medical Advisor, Dr. Richard Massé. Mr. Premier. Hello, everyone. First, I wish to thank Geneviève Guilbeault for having replaced me yesterday, our Vice Prime Minister, as you can see, or Deputy Premier. It is also other people's turn to take a day off, so Dr. Arruda is being replaced by Dr. Massé, who I understand was there before Dr. Arruda and was even a professor of his, so we trust him. And I have with me the Minister for Economy and Innovation, Mr. Pierre Fitzgibbon, because I want to talk to you a little bit about what will happen after. We're already taking care of this, and we want to talk about local economy. But before going any further, you have a chart here on the screen. The company Google made a data study in the 50 U.S. states and the 10 Canadian provinces to have a look at where the guidelines of staying at home were the most respected. And as you can see, and I am very proud of this, the state that respects the guidelines the most out of the 60 states and provinces is Quebec. So I'm really proud of Quebecers, proud of seeing these results. And I, of course, want to say bravo to everyone and thank you all. And what is very important is that I am convinced that this will have saved hundreds of lives. It's not just a question of being proud and of being first. It's that is going to give concrete results. So bravo, bravo, bravo. Now, the daily numbers. Unfortunately, it's always difficult, but we have 19 new deaths. A total now of 94. I, of course, wish to offer my condolences to the families and the loved ones of those victims. We have now 7,944 confirmed cases. That is an increase of 947. 525 people are being hospitalized, an increase of 47. We have 154 people amongst those 525 that are in ICU. That is an increase of 24. As far as the equipment is concerned, which is our big priority, we received orders yesterday for masks N95 as well as gloves. So today we are at about 13 days worth for these two items. As far as procedural masks and gowns are concerned, for procedural masks, what we call surgical masks, as well as the gowns, we are waiting for orders. We haven't really received any yet. We now have 7 days worth of these two items. I can tell you, amongst others, with the Minister of Economy, that we are looking at all sorts of alternatives in order to manufacture those equipments ourselves here in Quebec, because we do expect that in the following weeks and months, it may become more and more difficult to order. Every country in the world is looking for them. We're also looking at certain alternatives. For example, the gowns, we're looking at the possibility of having gowns that would be washable, so reusable after having been washed. So we are trying to be creative to prepare ourselves if ever we started being short of equipment. So as you can see with today's numbers, we're still in that ascending curve. We hope in the next few weeks to get to a summit, and we will be giving you scenarios the day after tomorrow, so Tuesday. But it remains that we still have for a few weeks' worth, and after that we're going to have to make sure that we are in the descending curve before we can start with our regular activities. So today I wish for us to be realistic And I am announcing that businesses and non-essential goods and services that we had closed until the 13th of April, that date will be postponed to the 4th of May. So we're giving ourselves a margin. We hope, if possible, to start reopening before then. But to be realistic, we're thinking that it will probably be until the 4th of May. And of course, and later Pierre will be able to talk to you about it, we're already getting ready for what comes next. So once the curve starts going back down, once we get public health's okay to go ahead and to reopen certain businesses where employees can work at it remotely, for example, well, we're working on that. Pierre is also working almost night and day to try to save as many Quebec businesses as possible. And today he'll be talking to you about a project that he's been working on with a group of entrepreneurs and managers called the Blue Basket, Panier Bleu. A very nice project which targets regrouping on the same web platform Quebec products, because it's going to be a message that we're going to be launching in an increasingly significant way in the weeks and months that are coming. It will be more important than ever that we change a little bit our habits in terms of purchases and that we try to purchase Quebec products. So on that platform, there will be regionally all the Quebec products. Of course, there will be a transfer more and more with what has happened towards online purchasing, towards delivery of products. So we wish to ensure that as much as possible, Quebecers do purchase Quebec products. And so the Blue Basket will have that as a purpose. And Pierre will be talking to you about it later, but I just wanted to create awareness in Quebecers. You have to buy, we have to buy locally, we have to buy Quebecers so that our local companies can keep going and so our workers can keep going. My daily thanks. Well, entrepreneurs. I wish to tell Quebec entrepreneurs who are now going through difficulties that I understand the situation in which you are. I can understand that some of you are discouraged. I know what it's like. I was an entrepreneur myself. We work hard without counting how many hours. We make sacrifices, and all of a sudden, through no fault of your own, this event, this crisis takes place that makes it that you're thinking all those years are now lost and wasted. So I want to tell you that Pierre and his team are working really hard so that we can save a maximum of companies and businesses in Quebec, and that we be ready to help you when we start going again in the next weeks, that you have everything that is necessary to relaunch your business. But I'm saying in a few weeks, it's important to not ease our efforts in the upcoming weeks. If we ease our efforts, it is only going to delay the moment where we can come back to a normal life. So the fight is far from over. I would even say that we're entering into an even more critical phase in the next few days and weeks, and this will be decisive in this fight. Our objective is that the curve goes up, yes, but our objective is really that we can get through the peak and flatten that curve, and that is why we are broadening and postponing to the 4th of May the closure of businesses and stores to put all the odds on our side so that there be the fewest physical contacts, spread, transmission of this virus. So I repeat our 3 priorities as much as possible, and you're doing it well. We can see it. Stay at home. If ever you're forced to go out, please make sure to always stay 2 meters or 6 feet away from other people. And when you get home, wash your hands with soap. If everybody respects those guidelines, we will save hundreds of lives. So it is worth waging these efforts, and I count on you. Thank you very much. Now,
I would like to say a few words in English. Good afternoon. Google has released data showing that the people who have made the most intense effort to distance themselves in North America are Quebecers, more than all other Canadian provinces and more than all American states. I want to congratulate and thank you. Physical distancing is the most powerful weapon we have to win the battle. In order to finish curbing the spread and to save as many lives as possible, I announce today that we extend the pause, the closing of non-essential companies until May 4th. We are preparing the restart of the economy in few weeks, but I insist on one thing. If we relax our efforts, we'll just delay the moment when we'll be able to go back to our lives. The battle is far from over. In fact, we're entering the decisive phase of this battle. Every action counts more than ever. Each gesture saves lives. So I repeat our three priorities. Don't go out unless it's necessary. If you do go out, keep your distances. And when you come back home, wash your hands. That's how we'll save lives. Thank you all.
I would like to now hand over the mic to the Minister of the Economy, Pierre Fitzgibbon. Thank you, Mr. Legault. Hello, everyone. So the prolongation, the closure of businesses and most of business operations that are judged to be non-essential is going to have human and economic consequences, and I think this is something that we all know. I would like first to reassure you that the government is already planning the relaunching of Quebec's economic activity. And with all my colleagues and ministers involved, we are working really hard on this file. The MEI and Investment Quebec can and will accompany companies to prepare this relaunch of activities and will do so. The programs that the federal government has announced are powerful and will allow to have a social fabric and economic fabric that will be important and significant, that will allow us to be more comfortable and flexible to help our companies. We are looking already at the specific effects that the crisis and the closure will have on each different sector of activity in Quebec. The impacts will, of course, be very different depending on the sectors. We are already preparing a reopening. Geographically speaking, we can also talk about a sectorial relaunch, and we're analyzing many different scenarios. There will be a quick recovery in certain cases, but very likely as well a deferred recovery in other cases. There are three phases of evaluation that we're looking at. The first one being that of operating under confinement. That's where we're at right now. And there's a lot of good practices that are determined. We're also preparing what we'll call the rebound, where we'll have to look at the strategic assets for Quebec and to look at the supply chain to make sure that it is efficient. And we'll also be looking at the anticipation of what will be the new world after this health crisis. We're going to continue, the relaunch team, to work with experts, with heads of companies, with economists, with sectoral representatives, and with business groups, including unions, to make sure that we are well positioned to restart the economy. I will say one word or two on the Blue Basket, the project that we're announcing today, the Panier Bleu. I think that the health crisis has allowed us to see to what extent we need an ambitious strategy for local business and e-business in Quebec. We are going to make this a priority. All initiatives that have been announced everywhere in Quebec are inspiring. Quebecers want to participate in this relaunching of the economy, and we have to converge all that energy. We encourage all private initiatives to develop business in Quebec. The Blue Basket is a federating symbol, a community. It will not compete with the private sector. Everything that is a break to the discoverability of our businesses has to be lessened. That is why the Blue Basket will always be a free service open for businesses and citizens. We wish that the Blue Basket becomes efficient as the symbol of Aliments Québec was in grocery stores. Local business has been supported for a long time by all sorts of really nice organizations like the commercial development societies. The Blue Basket wishes to have those as important partners. For example, $5 spent per week extra here per household is $1 billion more in the economy. An initiative to promote local businesses is not something that is against any other kind of exchanges. It is to allow our small businesses to be able to fight against other companies that have huge marketing resources. I'd like to remind you that in Quebec we have a commercial deficit of $20 billion, internationally speaking. So if we reduce our imports by $10 billion, and we increase our exports by $10 billion, we will be balanced and we'll have learned a lot from our U.S. friends. The Blue Basket is an OBNL. It is not there to make money. It is non-lucrative. It exists so that it is there to help out the companies and make Quebec richer. The Panier Bleu is already being very well governed with a board that will be made up of business people who are very experienced and know the retail industry, technology and marketing, the three key ingredients for the success of this project. We have recruited Mr. Alain Dumas, as a general director. Alain has 20 years of experience in marketing, in e-commerce, and in retail. He worked at Aubainerie, at Sobeys, and he was also the president of the board of the Quebec Council of Retail Business. We also have on the board Mr. Sylvain Prudhomme. Mr. Prudhomme has 30 years of experience in retail where he was CEO of Lowe's until recently. He also worked in Loblaws, Sobeys, and Walmart. We also have Mr. Alexandre Taillefer, an entrepreneur who's very well known. The board will not be paid. And just to be clear, Le Panier Bleu, the Blue Basket, is for all existing local and national platforms. The MEI is going to be giving a budget to that initiative, and it is important to understand that the vast majority of that money will go towards its production or the production for Quebec. Well, it won't build a good solution without promoting it adequately. We will also have this platform come alive with our experts in artificial intelligence in the management of metadata. The development of the first part of the Blue Basket is going to be about $250,000 for the next few months. The board has an excellent reputation, and I know that each dollar will be managed very carefully. I would like to personally thank the 15 or so people who worked on this project. All hours up until now have been giving pro bono under the leadership of two Quebec entrepreneurs, Mr. Alexandre Taillefer and Patrick Bibeau. This is how this project was born. I'm very excited by the creation of this Blue Basket. We are building a project of Quebec solidarity, which I hope will be recognized by all Quebecers. I would like everyone, I've noticed that the Premier often finishes his interventions with a positive thought, and I wanted to do the same thing by telling you that with inventivity and resilience that is recognized in Quebec companies, I am convinced that things will start again and will be amongst those who will be best positioned. We will now go to the question period. Concerning the Blue Basket, I'm trying to understand how that will work. Are we talking here about a site where all companies would be grouped that can deliver, for example? What is delivery going to be about here? And eventually, could the government help companies that want to have a delivery aspect? I think it's important to mention, first of all, that the Blue Basket is not a transactional site. It will be a repertoire, we hope, of every business of Quebec operation that can do online business on the one hand, and also allow consumers to find an inventory of all the products that they can find online. The transactions will be done with the respective sites of the different Quebec businesses. But on the possibility of supporting organizations in terms of budget to develop delivery service, because what we see right now is that companies that are doing well are those that already had delivery services before the crisis. Is that part of your strategy? Yes, you have to understand that the Blue Basket is a nonprofit organization, and the Ministry for the Economy and Innovation, well, as the name says, innovation is the heart of our focus, and we have a lot of projects to encourage. So retail traditionally has not been helped by the government, but now there's two things that we're looking at. Can we help businesses that are more innovative, delivery, and can we reduce our imports? I think that is also an important element. So now we have, we want to favor Quebec products, but also Quebec business. So this nonprofit organization is going to be the rallying cry, if you want. But behind that, we will have all the companies. Hugo Lavallée. Hello, Mr. Premier. So today you're saying that the pause is going to be longer. We've read a little bit in Quebec, but particularly in international media, economies and entrepreneurs that are questioning this kind of strategy, saying that the economic downfall is going to be even more important than the effects of the virus. In this chair 25 days ago during the first press conference, you said that for you it was health first and foremost. And I wanted to know, will it always be that when you're in the way that you analyze, or could you reconsider things with these economic information? Well, what we want is a balance. But right now, as long as we are in the ascending curve of this big crisis, health is what counts. When the curve starts going back down, and specialists are saying we could have another wave in the fall or in the upcoming years, well, then we will, of course, need to have a balance with the economy. Obviously, the reason why we have put every effort in health right now is to give ourselves the time so that the network, the health network, be able to deal with this first important crisis and to have enough beds, enough equipment to be able to deal with this first wave. But at some point, when we're in control, things start going back down. Even if there's other waves that come, if the health network is under control, if we are able, possibly even, of having some medication, of having a vaccine, well, we'll be in a completely different area. And that's what's important to say, is that, I'm really looking forward that that we'll be on the other side of this speak, and then we'll be able to have a look at what companies, what organizations, do we reopen schools, but we'll have gone through the peak of the crisis. And we're expecting that it will be in the upcoming weeks. So once we'll have passed that point, it will become a balance point between, yes, health, but yes, also the economy, because we need the economy to create, to create the riches necessary to give health services and all the services that we give the population. But right now, the priority, as long as we have not reached the peak, is health. He's thanked Quebec entrepreneurs earlier, but there's a lot of smaller entrepreneurs who feel abandoned in this situation because they have to close their stores, whereas Costco and Walmart stay open. We fear that in certain cases it will kill the SMEs in Quebec. Is that not unfair as a situation for them right now? Well, there are situations where, for example, big box stores that sell food and hardware that we judge to be essential can have departments that sell other things and come into competition with small businesses unfairly because they don't have the right to open in those sectors. We're trying to follow that and convince the bigger box stores to just sell essential stores. But as Pierre was saying it earlier on, Of course, there will be a new way of seeing things that will become accelerated in the next few months and years, and we are ready to do so. Our government will help so that a maximum of businesses sell online, because in fact I don't want to end up in a situation where Quebecers order on a U.S. site U.S. products. We're talking about big amounts here. I don't know if you want to complete, Pierre? Well, yeah, perhaps more generally for SMEs, I think we have to recognize that the program, the PCU, and the wage salaries, that creates a social net that is adequate, I think, for citizens. And we also see that the federal government announced that program of $40,000 of loans to SMEs, which is going to be done automatically because it is guaranteed 100% by the federal government. We announced at the MEI, Investment Quebec, the program with local investment funds, so $850 million last year. And on top of that, we have Investment Quebec. Mr. Girard, my colleague, postponed the tax payments and provincial sales tax and GST payments. So I think that we have created a social net for SMEs that will allow people to be able to at least live in the next few weeks. And of course, when we relaunch things, that is where the government of Quebec has to intervene more significantly. So I'm very happy to see what the federal government has done, because we now have the munitions and we have the time to plan things out. And when we start, we have to make sure that everybody be able to survive. And I think we might, miss some things, but I'm really confident, whether it be tourism, whether it be culture, whether it be agriculture, everybody is comfortable. And I believe that we have the team in order to do this work. And so this is something that will be taking place in the next few weeks. Mr. Premier, you're asking a great sacrifice once again to Quebecers, an extra 3 weeks in this break that has an impact on wages and businesses that are necessarily going to die. Could you explain how the first 2 weeks have helped? Because for the time being, we can't see any lessening in the name of daily cases, so we could ask, what's the use of continuing with this pause? First, you have to be careful about just looking at the number of cases. We've explained this before, because we are amongst the states in the world that test the most. And we have targeted quite well the people that we tested, the people who were most at risk. So it's one thing, the number of cases is one thing. What I'm following a lot more closely is the number of deaths. And for the time being, I am convinced, and public health could confirm it, that the measures that we've taken in the past 2 weeks, and we can see them confirmed by Google's study, has allowed to save lives. Because when we test somebody who tests positive, who needs hospitalization, and that we put them very quickly under a respirator, we're giving ourselves the chances that that person be cured and that they leave the system. If we hadn't tested that person and that suddenly that person died, well, there would have been more deaths. So the fact that we tested more and that there was more distancing, so people met up less, I am convinced. And you'll see it on Tuesday as well. We'll be able to take certain countries that have that started the crisis before we did, and you'll be able to see on the graphs that up until now we're doing better than the average, especially on the death toll, for where we are at in the curve. And that's what's the most important, Mr. Massé. Well, you can see the graph illustrates things first. Not only are we first, but you can see that almost everybody's doing it. And we did it fairly early on. We did it very efficiently. So the curve, yes, is increasing. So we can't say that we have, flattened yet. This being said, it takes about 15 days before we can see the effect. And certainly we would have a much higher curve if we hadn't done this. So on that, the studies are very clear. This is what we have to do. We're doing it well, but we also have to care for those places where there's vulnerability. So there's a curve of cases, and it's true that it depends on the resources that we put in to screen. But there are places where mortality arrives, unfortunately, and those places we really have to take care of as a priority, which is what we do in CHSLDs and residences for the elderly. So now, of course, there's a very particular emphasis that we have to continue, and we're going to have to continue sustainably, because we're asking ourselves the question, why continue? Well, essentially, if we slacken now, we would have an increase in transmission that would be really harmful for the most vulnerable people in our society. That being said, we may have to live with this virus for a good amount of time, and we will have to incorporate in our ways of doing things precautionary measures to be able to limit that kind of transmission, which will happen, but we'll have to learn to limit. I think that the most beautiful model that we're all trying to follow is that of Germany. I took my day off yesterday to read quite a bit, took advantage of that. Germany has a lot of cases, a lot of confirmed cases, but very few deaths, a lot fewer deaths than any other country in Europe. And when you search through things, there's two things. They did a lot of testing, about the same amount per capita of testing as we are doing, and Ms. Merkel was very hard on social distancing. She asked, and you know that Germans tend to be people who are disciplined, and now what we can see is that Quebecers are also disciplined people. So if we are able to get closer to the model and the results of Germany, I'm going to be the happiest guy on earth. There's a ministerial decree this morning that offers a premium of 4% to paramedics, whereas in the health network there's other who got 8%. Why are paramedics only getting 4%? Well, I'm happy to announce to you that that's been fixed and we've put it at 8%. Oh, if all questions could be so easy. So it will be 8% for them. Change of situation. Two questions. We will now go to another question. Police officers can now give a fine of many thousands of dollars to anybody participating in an outside gathering without the government ever having defined the word gathering. As of how many people is a gathering? Could a police officer give, for example, a fine to a couple talking with another couple if they judge that the distance of 2 meters is not being respected? No, there will be no fine for couples that walk around on the sidewalk one beside the other. What we wanted to accelerate the fine process and the tickets is to conclude together with the SPVM and the SQ to set up a new way of doing things where rather than giving a notice that goes through the DPCP, we can give the ticket right away. So it's a maximum of $1,000, but now it's a question of judgment. A gathering is a gathering, and being less than 2 meters away is less than 2 meters. But I trust police officers' judgment to hand out those tickets. And it is subject to the second question. The great latitude given to police officers could bring to an authoritarian abuse of power. Should we be worried as citizens to the increasing arbitrary power given to police forces? Well, first of all, it's very temporary, only while the crisis lasts, and I'm quite convinced that most Quebecers will agree that police officers use their judgment and give tickets to those people who are not respecting the guidelines. I trust the police officers.
Bonjour à vous, Monsieur le Premier ministre. Ma question va s'adresser au Dr.
My question is to Dr. Massé. I'll let you have a look at your statistics because it's a bit sad we're talking about people who have died. But it's important to understand, out of the 94 deaths that you have, are these, did these happen at home, in CHSLDs or hospitals? What is a portrait of people dying right now? Well, the people who died in CHSLDs right now corresponds to about 40% of the total deaths. As far as the residences for the elderly, it's about 20%. There are also people who came from support networks, others, and at home. So you can see that most are people who live in residences for the elderly or CHSLDs. So what I want to say is that there's been outbreaks in those places that explain about half of the deaths. Outbreaks of more than 5 people. And of those outbreaks, we have seen them in 25 establishments out of a total of 11,000 facilities. So what we can see is that it was concentrated in a few places where there was a transmission that was accrued. And that represents about 70%. 60% of the deaths, those things. So that was an important phenomenon, and that is why we've been saying since the beginning that it is something that we have to be careful with. It's something that we have very prudent with, so that there not be any introduction of people who are positive. So we're asking everyone who goes there for work to take every precaution, and we ask people in our PAs that the residential physiology that there be no regroupments, no gatherings, people going to have a coffee. If there are hard conditions, I think that it is a protection measure that is essential. Mr. Fitzgibbon, you launched a program for help to companies where you at the pause has been increased by 3 weeks. So a lot of small companies are going to go through a lot of difficulty to start again. Your prognostic right now is the 4th of May, and maybe it'll be longer. Well, listen, I don't have all the statistics. I have the ones that go through Investment Quebec. We have about 400 formal claims that have been made that are not far from $1 billion, but we have to be careful with those numbers. And also, let's remember that we encourage companies to go see their bankers because, on the one hand, the federal government announced a $40,000, which is 100% guaranteed, and for people who are above that threshold, there's going to be loan guarantees of 80%, which is equivalent to what we offer at Investissement Québec. So we have a lot of companies that are in discussions right now with the banking sector, and I must say that it's going very well. It was complicated at the beginning. The federal government was announced a little bit after ours, but I think that right now there's very good cooperation between the financial institutions and Investissement Québec, as well as with the BDC. And I don't have the total amount, but of course there's a lot of, or the CDB, I'm sorry. But of course, we will be adding to this fabric by adding $150 million that was going to be made available for loans below $50,000 in municipalities through, in all likelihood, the local investments funds.
Tommy Chouinard de la Presse.
Bonjour. D'abord, Monsieur le Premier ministre, j'aimerais connaître...
Mr. Premier, I would like to know the impact of the decision of prolonging by 3 weeks the closure. I would like to know the estimated impact on the Quebec economy as well as public finances, whereas the Minister of Finance was telling us a few days ago that the bill for everything that's being done right now was at about $18 billion. Well, we're going to have a rule of 3 eventually on what was calculated for the first 3 weeks. But right now, as I was saying, and I've been saying since the beginning, it is not a question, an economic question. It's first and foremost a question of health. And we wish to make sure that before we take back control of the increase of deaths and cases, so that is when things stabilize and start reducing, where we're going to have to put in there the money that is necessary. Now, we're being bombarded with comments right now. It would seem that the site of the Blue Basket is already being visited. When you were evoking the idea of a reopening to the 4th of May, I would like to know, you were talking about sectors, regions. For you, Mr. Premier, what will be the priority? What is going to have to be open first? A lot of people are asking themselves questions about this. Well, first, we're going to have conversations about this with public health, but I think that we could imagine that those businesses that are able to function with employees staying 2 meters away from one another are going to be able to open first. The regions and sub-regions where there's fewer cases, where the cases are going down more quickly, could also be amongst the first to be reopened. But it's distancing and the number of cases. But as long as we don't see a lowering in the number of cases, we cannot consider reopening.
Monsieur Legault, on parlait...
Mr. Legault, I think I asked you this question on Friday on the future, what will have to happen in terms of autonomy for Quebec. You talked about food autonomy. Have you mandated your economic team to find solutions to ensure that we don't have these shortages anymore? Will there be help, for example, to make it so that we manufacture medical equipment that are not manufactured in Quebec right now, which for reasons of cost are being done in Asia, could there be a model to make sure that we no longer depend on Asian countries? Yes, absolutely, and I can let Pierre complete. But amongst other things, there are two sectors where we can see that it is very important to be more autonomous. One is the medical equipment, and I will even add medication to that. Generic medications, we have to be able to, in the health sector, we have to be able to be independent and autonomous. The other sector that we are looking at that is essential is to be able to feed people. We cannot imagine tomorrow morning that for all sorts of reasons we stop getting fruit and vegetables that come from the south of the United States in the winter, and that we no longer have enough food for everybody. So the entire food supply chain, from the farmers going through processing, and when it gets to retail stores, this is becoming critical. So these are two examples of sectors, where we wish to be more autonomous. So today we're talking about the blue basket, le panier bleu. Eventually, deliveries, of course, in the new world in which we'll be living, there will be more and more products that will be delivered. So we have to have a computer infrastructure. We have to have people to deliver. We already have, Post Canada or Canada Post that is doing a part of it, but we'll have to develop that entire sector for delivery. So those are examples. And yes, Pierre is looking at things sector per sector with experts, with people having, predictions, who are giving him all sorts of documents that you read during the day, I read at night. Pierre, do you want to talk about it? Well, specifically, I think that strategic procurement is taking a much different sense right now. Medically, we know that we're having problems with the N95 mask, the procedure mask, the gowns, the gloves. Those are the four main products. The Ministry for the Economy, our function is to be able to look at Quebec companies that could manufacture. Some will be able to do so quickly, others less so. And right now, we have about 80 Quebec companies that have shown an interest and a capacity to produce these materials. So, of course, we'll want to, on the one hand, try as quickly as possible to be self-sufficient, and on the other hand, I think that the health crisis, which is going to end soon, but there could be other ones in the future. So I think that, I could confirm that there's good chances that we'll be able to be self-sufficient in those products if ever there is another crisis. Of course, when the crisis is over and there will be less demand for those products, those companies are probably going to stop the manufacturing, since there will be competition coming from Asia that is going to produce the same material as they for a lesser cost. So couldn't there be a government procurement policy for purchasing to allow those manufacturers to continue living while being conscious, of course, that it will be more expensive than those same products manufactured in other companies? We have two companies that are going to convert the operations to make those products. So you're right, in these cases, they're probably going to go back to doing what they were before. And we are in very advanced companies with a company that is going to only make masks in a permanent way, and who will be able to export them as well. So I think as a government, we have to look at strategic procurement. And Mr. Legault also talked about medication. We're already discussing with the Ministry of Health and of the Economy to see what, are companies that make medication, to make sure that we can have good procurements. Of course, the health crisis that we're going through right now is waking people up, and we definitely want to be as self-sufficient as possible. But there's a lot of companies, that will go back to what they were doing before. A couple of extra comments. First, the ministries are going to have to be better models for local purchasing. We're asking Quebecers to purchase locally. Well, we'll have to make sure, while respecting international laws, that our ministries also purchase more goods and services locally as well. Now, Pierre was talking early on about the deficit, the commercial deficit of 20 billion. We might think that some of our exports are going to be facing a little bit more protectionism in the next few years. So to compensate the fact that we already have 20 billion in commercial deficit, and that we might see a lowering in our exports because of protectionism, we ourselves are going to have a list, and that's what we're doing, of all our imports, including those from Asia, and seeing how we can help our entrepreneurs to manufacture those products locally that we're importing in order to keep a commercial balance that is as balanced as possible. Now we will go to English questions.
Yes, hello, good afternoon to the three of you. Yesterday, a security guard in Sherbrooke was involved in an accident in the parking lot of a Walmart in Sherbrooke. Allegedly, he was hit by a car that was by a customer who was apparently refused entry to that store. We're also hearing reports of grocery store employees saying people are increasingly nervous, impatient. So with this additional 3 weeks, are you concerned about keeping the social peace in Quebec, and how are you going to make sure that those frontline workers who are providing food and medicine to Quebecers are safe?
Okay, what I have, the information I have about Sherbrooke is that there were two people who wanted to get together in the store, and they said you have to be only one at a time. And the guy used his car to hit the guard. Unfortunately, you have few crazy people in our society, but I don't heard that it's happening much in Quebec, so it's too bad. And of course, it's unacceptable what happened in Sherbrooke, but they had already a guard, and the guard was the guy hit by this crazy guy. So what can we do against that?
I'll ask a question to Mr. Fitzgibbon. Business owners in Quebec are learning today they won't be able to reopen until May 4th. Can you explain what these companies can expect in terms of support from the province? You were mentioning some industries may be able to reopen gradually, depending on the region. So can you give a bit of explanations to the business owners?
I think we have to dissociate the medium-sized large enterprise from the SMEs, the small enterprise. I think that I said that the federal programs that they have announced for the subsidy for the salary, or for the emergency fund for individuals who have no employment, together with the $40,000 loan that will be fully guaranteed by the federal government. If you add that to what we have established in Quebec with $150 million through the various MRCs, I think we can provide liquidity to a large extent to these SMEs, even though for the next 3 weeks, those who are currently closed. Furthermore, my colleague Éric Girard has postponed, as you remember, the sales tax, has postponed the income tax. So generally speaking, I feel pretty good. We have to address the rental. The May 1st period will come soon. And as far as the medium to large size enterprise, some of them are already operating for the essential product services. And of course, the ramp up will be delayed. But to be honest, I don't think anybody expected April 15 that they would be just opening the lights. And I think we have clearly put together a program through Investissement Québec of $2.5 billion to assist these companies. And together with the federal government programs, I think we've got ample financial resources to provide liquidity for that extended period.
Now there's a question from Phil Autier from the Montreal Gazette that partially answers his question, but could you explain a little bit more about your initiative that you're launching today about the panier bleu? Will it be called the blue basket in English? What's the?
It's going to be called. By the way, I should have shown that. This is the visuals of the panier bleu, which I think is pretty interesting, pretty nice. So the panier bleu, what it is, or what it isn't. It's not a transaction site. It represents an ecosystem where the various retailers can subscribe to that, subscribe for free, can put themselves on that site, which will allow to have transaction with these different constituencies. The consumer on the other side are able to access that site and to look at the products that they can buy from Quebec enterprises. And as we all know, when people go on Amazon, they often go there to see what product exists. So we want to replicate the same thing, and we want the panier bleu to be basically a depository for all the Quebec products that are offered by Quebec enterprise. And if we can increase by $5 per week the consumers' purchase of Quebec products, that's $1 billion more in the economy. It's huge. So that site happens to be an umbrella. We want to federate the population of Quebec enterprise and to allow the consumer to see clearly through one site. And very importantly, other initiatives that currently exist, we've inventoried more than 100 different initiatives, are going to be able to work towards that panier bleu. So it's not in competition to what exists. It's just meant to be an umbrella to oversee all the Quebec activities.
Now, questions from Raquel Fletcher from Global News. There's a serious concern about the safety of seniors in seniors' residences. What is being done to ensure that safety when 1/4 of all homes in Quebec have outbreaks?
Well, this is a very important matter because, as you know, there's been many deaths in that group age, and those are very vulnerable. And so there's been a lot of actions given in those areas to increase the support of persons, to minimize the number of persons going in elderly's places, and secure the places in certain instances. Be sure that people that are going in those elderly homes won't get visited and won't get outside, which happened at the beginning of the pandemic, and that was a real cause of concerns, and we have had outbreaks out of that. So and this is now in control. This is quite different right now. In long-term care hospitals, that's another issue, and there's a number of deaths related to that. So there's a plan that's going on right now to support those institutions to have all the necessary capacity to protect the people in those homes. And so the demand that we made many times in the last few weeks is something that needs to be kept on for quite a long period, in fact, because coronavirus is going to stay with us for a number of months or maybe years. So we'll have to be careful, and that might change the way that we will provide services in the future.
Second question is for Mr. Fitzgibbon. When will new money for small businesses be distributed to municipalities? Some businesses will not survive if it takes months. Also, do you have any idea of how many Quebec businesses may not survive this crisis?
Well, the latter part of the question, I'm not sure, but the first part is first the FLE, which are the already units operating. We have 112 of them in the province, so they're already functional. They already have their relationship with SMEs, but also these companies can also go to their bankers. So either we'll provide loan directly from the FLEs, or we provide loan guarantees. So I think we can access pretty quickly pretty much all the companies, given that we are in the region. As far as the number of companies that will need that or will have liquidity problems, as I said earlier, I think there are various programs that exist, and we feel good that either the social filet or the SMEs filet is there, and whether it's tax postponement, whether it's a sales tax, whether it's a salary subsidy, I think we've got a panoply of different programs, but of course we'll have to be reacting as they come. But I think we've got the tentacle in the province to suffice for pretty much everybody.
And last question from CDV. We're hearing from people who were sick, who are now symptom-free, who want to be tested again so they can be sure that they can go outside and not infect others. Why is this, and how do people know when they're fully recovered?
Maybe I can start, and Dr. Massé can continue, but it's a question of priority. We prefer to test people with symptoms to see if they are positive than testing people without symptom that would like to know if they don't have anymore the COVID-19. So it's a question of priorities. Eventually, we'll test those people, but right now it's more urgent to identify the positive cases.
And in those cases, you know, when it's after 14 days that people have had the beginning of their disease and they have been free of symptoms for 48 hours, we know that those persons are okay. They won't transmit to others. So, but if people have symptoms, you need to wait until they have all symptoms resolved and then wait for that.
Voilà, c'est ce qui met fait à cette conférence de presse.
And this is the end of the press conference. Thank you, everyone.